Thanks for joining us for today's webinar on the nursing labor market in California, still in surplus. This webinar is a partnership of the University of California, San Francisco, the Hospital Association of Southern California, and the California Institute for Nursing and Healthcare. We have three speakers for today. Myself, I'm Joanne Spetz. I'm a professor at the Philip R. Institute for Health Policy Studies at UCSF. And then I'd like to introduce Terry Hollingsworth at the Hospital Association of Southern California. Terry, why don't you say hi to everybody?
Good morning, everyone.
And then also Judy Berg, who's the Executive Director of the California Institute for Nursing and Healthcare.
Good morning, everyone. Pleasure to be here.
The goals of today's webinar are to learn about how the labor market is currently faring in California for registered nurses. We have a number of different surveys and data sources that we've been using to assess the situation for the labor market. We're going to start by talking about how chief nursing officers are perceiving the labor market, and then follow that up with the latest hospital and vacancy turnover data. We'll then talk about how recently graduated nurses report that they're faring in a survey of new graduates, and link all of these data with other recent data on RN employment and education in the state. We'll also measure the impact of enrollment trends on current forecasts of future supply and demand for nurses in California, and talk about next steps for ensuring an adequate nurse supply. This work is a collaboration of multiple organizations. Our primary source of funding is the Betty Irene Moore Nursing Initiative, which is a program of the Gordon and Betty Moore Foundation. I'm at the Philip R. Institute for Health Policy Studies at University of California, San Francisco, and the other partners in this work are the California Institute for Nursing and Healthcare and the Hospital Association of Southern California. We'd like to acknowledge and give thanks to the California Hospital Association, the Hospital Council of Northern and Central California, the Hospital Association of San Diego and Imperial Counties, and UCSF staff and interns who participated and supported this study in various ways. So what is going on in our nursing labor market? After more than a decade of severe shortage from about 1998 to 2008, we've been having sporadic and periodic reports of nursing surplus in various regions of California. This is in the context of an ongoing recession with a very slow economic recovery, high unemployment rates, particularly in some parts of California, such as the Central Valley and Inland Empire, and severe regional differences across the state in the nursing labor market as well as the broader economy. One of the ways that we can gauge what's happening for the nursing labor market is to survey chief nursing officers and ask them what they see. We've been conducting a survey of chief nursing officers now for 3 years. This has been fielded by the University of California and supported by the Gordon and Betty Moore Foundation. It's a web-based survey with an option to return a paper survey via fax or email. Basically, it's a fillable PDF, and the data now feed directly into the database that the web-based survey feeds into. The questions are based on a previous survey that was developed by the California Institute on Nursing and Healthcare, as well as recommendations from the National Forum of State Nursing Centers on data elements for a minimum demand data set. Thus far, 5 surveys have been conducted starting in fall 2010. The spring surveys and the fall 2012 survey were focused solely on CNOs for the component that UCSF did, and then the fall surveys included HR data. In fall 2012, the Hospital Association of Southern California's vacancy and turnover data were incorporated into our overall statewide report, representing a new collaboration between HASC and UCSF. So one of the key questions in the survey of chief nursing officers is a simple question asking them what their perception of the labor market is. They are asked to rate the labor market on a 1 through 5 scale, ranging from high demand, it's difficult to fill open positions, which is a score of 1, through a score of 5, which is that demand is much less than supply available. So on the left side of this bar are the respondents who said that they experienced high demand and it was difficult to fill open positions. And that's remained stable at about 5% of respondents over the 3 years of the survey. On the other end of the scale, where demand is much less than supply available, in 2012, 12.4% of respondents said that demand was much less than supply available for them. But that is an improvement over 2010, where nearly a quarter of respondents said that demand was much less than supply available. Overall, these data suggest that there is some strengthening to the labor market, with more job openings becoming available for nurses. There are significant differences across regions. If we give those 1 through 5 ratings that you saw on the previous slide a score of 1 through 5, then we can put this into a scale where 1 would indicate that there's the most potential for shortage, and a 5 would indicate the greatest degree of surplus. A 3 would indicate a very well-balanced labor market. You can see for California in 2012 that the gray bar indicates an average score of 2.9, which would suggest a mostly balanced labor market, perhaps with a little bit of a leaning towards shortage. Some regions of California have more of an indication that there may be a shortage, particularly the Inland Empire with an average score of 2.2, and Central California with an average score of 2.6. But in contrast, other regions of the state have more of an indication that there may be surplus, such as the San Francisco Bay Area with an average score of 3.2, as well as some of the other regions of the state, like the southern border region with a more balanced labor market, and Sacramento and Northern California. Note for all of the regions of California, with the exception of the Sacramento area, the labor market has strengthened in terms of there being more jobs available relative to supply over the past 3 years. Now, there are notable differences between urban and rural areas. The left bars are the rural regions of California, read 2.6, indicating generally probably a balanced labor market, but some difficulty filling positions. For the urban hospitals, which is the right set of bars, you can see that in 2010 the market leaned towards surplus, and now there are some variations by hospital size as well, with smaller hospitals generally being more prone to report that they're experiencing difficulty filling open positions, and hospitals that are over 300 beds or even over 200 beds indicating that they may be experiencing some degree of surplus or more applicants than there are jobs available. CNOs were asked to report to us the changes that they'd experienced in the difficulty of recruiting nurses compared to the previous year in fall 2012. So they were asked to be reporting the change that they'd seen since the previous fall of 2011. For staff nurse positions, you can see that 28% of CNOs said it was now less difficult to recruit staff RN nurses than it had been the previous year, and only 10.4% indicated it was more difficult. However, for other RN positions, which would include any RN position that might not involve direct patient care, such as case management, infection control, or overall leadership and management roles, 26.2% of CNOs indicated that it was more difficult to recruit in fall 2012 than in fall 2011, and only 11.7% said it was less difficult. For LVN and unlicensed aid assistant positions, almost all hospitals reported that recruitment was about the same or it was less difficult than in the previous year. Employers were asked to report whether there had been an increase or decrease in their employment over the previous year. As you can see, for most hospitals, there has been no change in employment between fall 2011 and fall 2012. For some positions, such as licensed vocational nurse, the balance of responses indicated also that there was some decrease in employment. About a third of respondents said they reduced their employment of LVNs, as compared to only 14% saying they increased their employment. For registered nurses and other RN positions, it was a pretty even number of, or share of hospitals that reported increasing versus decreasing employment. And for new RN graduates, a little bit over a third of CNOs indicated that they had increased their employment, as compared to 28% saying they decreased their employment. So there's a little bit of increase in employment in the net for new RN graduates. Employers were asked what kinds of changes they'd experienced in the past year in their employment and hiring. The most oftenly cited response was that they were experiencing budget constraints over the past year. The second most common response was that there were fewer RN retirements than they had anticipated, thus affecting their hiring. And also a large number of hospitals said that they had experienced a reduction in their patient census. Other common responses were less turnover of staff, decrease in use of temporary and traveling nurses, current staff are working more shifts, current staff are converting from part-time to full-time. Some hospitals said that they're experiencing a hiring freeze, an increase in the use of temporary and traveler nurses, and then less foreign recruitment. Speaking of foreign recruitment, in 2010, nearly 7% of chief nursing officers indicated that they were engaged in international recruitment of registered nurses, but the share had dropped to less than 2% by 2012. For hiring of newly graduated registered nurses, chief nursing officers were asked if they had hired new graduates this year, if they normally hire them but did not this year, or they never hire them. Around 8 to 10% of CNOs have consistently reported that they do not hire newly graduated registered nurses. Those are typically CNOs in hospitals that focus on specialty care or have a very tertiary set of services that rarely require new graduate types of positions and mostly focus on specialized and experienced nurses. 77.6% of hospitals in 2012 indicated that they had hired newly graduated nurses that year, which is a reduction from 2010, where nearly 85% said they'd hired newly graduated nurses. Employers were also asked if they had specific hiring requirements for new graduates or preferences for hiring new graduates. About 21% of employers have indicated over the past 2 years that they do not have any experience requirements for hiring into their nursing positions. But about 55% in 2012 said that they expected a specific type of experience, including experience in areas like the emergency department or operating room, in order to hire into currently vacant positions. About 7.3% of hospitals in 2012 indicated that they required that new hires have a bachelor's degree or higher degree in nursing, and nearly 68% said that they preferred a bachelor's degree. Nearly 54% indicated that there was a minimum experience requirement in terms of a number of years after graduation. Some employers offer new graduate training programs. In fall 2012, 71% of hospitals indicated that they had a residency program. 82% of these hospitals had developed their program internally, and the remainder had used an off-the-shelf type of program such as Versant. The most common capacity of these programs is to intake 20 to 30 new graduates at a time, and the most common length of these training programs is about 12 weeks. Chief nursing officers were asked what they expected their hiring to be over the next year, from fall 2012 to fall 2013. In the fall 2012 survey, just over half indicated they expected no change in their hiring over the next year. But 31% suggested that they expect to hire more nurses than in the previous year, and only 17.2% indicated they expected to hire fewer than the previous year. As compared to the 2011 survey, this suggests that more hospitals are expecting to do more hiring over this next year. For those who said that they expected to increase their employment, the most commonly cited reasons were an increase in patient census that was expected or an increase in bed capacity. A fair number of respondents also said they expected to decrease their use of traveler and contract RNs, and another number indicated that they plan to have more RN retirements than they expected or than they have had in the past few years. A small number of respondents indicated that they were engaged in care model redesign that would result in increasing employment. For those that are decreasing their employment, the reasons for those decreases share some similarities to the increased employment. For these hospitals, rather than expecting an increase in census, they are anticipating a decrease in their patient census. 25 of the 37 hospitals that indicated decreasing employment said their main reason was less turnover of staff, and a little over 20 said that they expected fewer RN retirements than they might have normally anticipated over the next year. For those that are decreasing employment, other reasons included hiring freezes and budget constraints, as well as current staff working more shifts, thus reducing their need to hire more staff to fill those shifts. Chief nursing officers were asked what their hiring expectations for new graduates were for the future year, and about 55% indicated they expected no change in their hiring rate for new graduates, and even shares of 22.3% each indicated they expect to increase hiring or decrease hiring. So now I'd like to have Terry Hollingsworth talk about the latest hospital vacancy and turnover data that the Hospital Association of Southern California has been collecting and how these align with the Chief Nursing Officer perceptions.
Great. Thank you so much, Joanne. Thank you for allowing me to present highlights from the third quarter 2012 Healthcare Workforce Survey. The Healthcare Workforce Survey is a joint effort of the Hospital Association of Southern California on behalf of all hospital associations in California, the University of California, San Francisco, and FutureSense, Inc. On average, 180 hospitals across the state participate in this quarterly survey that captures information on workforce trends including turnover, new hire, and vacancies. In the past, hospitals have completed multiple surveys from HASC and UCSF to submit workforce data. We have now streamlined the data submission process for hospitals by merging our surveys together so that hospitals need to complete only one survey. The goal of the Healthcare Workforce Survey is to help hospitals make stronger and more strategic workforce decisions, advocate for healthcare education spending, project long-term supply and demand trends across the state, and support local policymakers in their workforce development planning. So with that said, I'd like to now get into the results of our third quarter results. During third quarter, we had 165 hospitals participate, representing approximately 86,230 RNs and other nursing categories. In this first chart, you see that as far as separations, and let me define separations. Separations are defined in our survey as employees who separated from the hospital during the third quarter, and we're including both voluntary separations where the employee made the decision to leave, including normal retirement, and involuntary separations where the employee was asked to leave due to performance. So in this third quarter, we're showing staff RNs at a turnover rate of 2.5%, or 1,981 staff RNs separated during that quarter. The other RNs category, and as Joanne defined other RNs, registered nurses who do not provide direct patient care but serve in other capacities. And this could include case managers, infection control nurses, and other nursing professions. We're showing a turnover rate of 2.4%, or representing 112 other RNs. We see for new grad RNs, turnover rate of 3.8%, or 41 new grad RNs, and then followed by LVNs at 3.7%, or 126 LVNs, and aides or unlicensed nursing positions at 3.5%, or 273 that separated during that time. Moving on to hiring, staff RNs were showing a hiring rate of 2.9%, or approximately 1,800 staff RNs during that quarter, followed by the other RNs category at 2.1%, or 98. Then we have the LVNs at 1.5%, or representing 53, followed by the aides and unlicensed nurses at 3.7%, or 292 aides and unlicensed nurses. Next slide, please. Percent of new hires that were new graduates. Overall, we're showing a rate of 26%. This represents 469 new hires. And we break it down by full-time and part-time. Full-time represents 32%, and part-time at 6%. Next slide, please. Per diem travelers and agency use. So this chart shows that based on the total number of respondents, what percent utilizes per diem travelers and agencies. So looking at per diem category, For the RNs from 2010 to 2012, we're showing in 2010 12.8%, slight drop to 12.4%, and an increase to 14.7%. And those are the first three bars that we're looking at from the light pink to the darker maroon. For the LVNs category from 2010 to 2012, we show at its highest point at 16.9%, hospitals utilizing per diem, a drop to 8.6%, and an increase again to 15.2%. And as far as travelers and agency workers, we're showing a small number of hospitals utilizing these two categories, and we think that this could be partly due to hospitals utilizing their internal flow pools better and becoming more knowledgeable on how to staff internally. Next slide, please. The next slide shows the number of vacancies from 2010 to 2012. And as you can see, starting 2010, we're showing vacancies for RNs at 3.4%, going up to 4% in 2011, and in the fall, a slight drop of 3.8% in 2012. So these numbers have been pretty consistent. We haven't seen any significant changes in these numbers overall in the report. Next slide, please. And the next slide shows the vacancy rate by position during the third quarter, starting with the staff RN category. We're showing 2.9%, or representing total vacancies of 2,434 vacancies. The other RN category at 7.1%, or 343. New graduate RNs at 5.9%, or representing 86 vacancies. LVNs at 3.7%, representing 133 vacancies. And then the AIDS and unlicensed nurse category of 4.9%, or 413 vacancies. Next slide, please. Then we have our next slide, vacancy rates by part-time and full-time status. And so we have the staff RNs at 3.5%, full-time and part-time at 2.1%. The other RNs category at 6.7% for full-time and 1.9% for the part-time category. What's most notable about this particular chart is the number of part-time new graduate RNs shown to be more so in the part-time category than the full-time category. The full-time category showing at 5.8% and part-time at 9.5%. We then have the LVNs at 4.1%, full-time, and the part-time at 8%, and that too is notable, as well as the AIDS and unlicensed nurse category of full-time 4.7% and part-time at 2.6%. Next slide, please. And that's it for me, Joanne.
Great. Well, now I'd like to turn it over to Judy Berg, who can tell us about how recently graduated nurses report that they are faring in the California Institute for Nursing and Healthcare survey of newly graduated nurses.
Thank you, Joanne. I'm pleased to share this data with you. This is data from a survey of new graduates conducted in the fall of 2012. And it represents a collaboration of organizations who come together to collect this data, the Institute being one of those partners, along with the UCLA School of Nursing, the Board of Registered Nursing, the Association of California Nurse Leaders, and the California Student Nurses Association. And of course, we could not do it without our funder, who is the Kaiser Permanente Northern California Fund for Health Education at the East Bay Community Foundation. And we are grateful for their interest in nursing and in providing funding for this survey, which they have done for the past 3 years. This survey is conducted with a random selection of half of the newly licensed registered nurses in California between September 2011 and August 2012. So it's for a 12-month period. And during that time, there were 10,294 newly licensed registered nurses in California. So the survey went out to half of those newly licensed registered nurses. And they received a mailed letter with an invitation to complete a web-based survey. We got a 24% response rate, which is higher than we have received in the past, and we were very pleased with that. In looking at survey responses, we noted that the associate degree nurse new graduates, newly licensed registered nurses, were slightly underrepresented in the 24% response rate, as well as those newly licensed RNs who had graduated from a baccalaureate program were slightly overrepresented. However, that was not a significant difference, and we also had very good geographical representation throughout the state of California, and it very much mirrored where graduates went to school and where they live. Next slide, please. We found in the survey that 54% of new graduates were employed. That number is a little bit higher than the previous 2 years when we found that 57% of newly graduated nurses were employed as a registered nurse. However, this number of 46% not yet being employed is pretty consistent with the survey from the National Student Nurses Association in their survey data from 2011. They have not yet released their survey data from 2012, although I have spoken with the staff from the National Student Nurses Association, and they indicate to me that there was not a big change between their data in 2011 and 2012. So I'm assuming it's going to continue to be somewhere around the 45% mark. We also looked at data from the American Association of Colleges of Nursing survey in 2012, which is more recent data. Their data only collects information about new graduates with a BSN degree and their hiring experience, and they found that 43% were unemployed, or 57% were finding jobs. So again, it's going to be pretty consistent with our data in California. Next slide, please. There is, however, some regional variation in unemployment in the state for new graduates, and this is very consistent with what Terry has shared as well as what Joanne shared earlier. The probably most opportune place in the state for new graduates to find positions is in the Central Valley. You'll note that about 2 out of 3 new graduates are finding jobs in nursing in the Central Valley. Conversely, the most challenging place in the state to find a job as a new graduate is in the San Francisco Bay Area, where only 43% of new graduates are finding employment. So this regional variation in employment across the state is pretty significant in terms of where new graduates are more likely to find employment. Next slide, please. There we go. Unemployment also varies a little bit by education, although probably not really significantly so yet at this point. We're finding that the degree that you graduate with from your nursing program does seem to have a little difference in that nurses who are graduating with an entry-level master's are finding employment more easily than our nurses who are graduating with an associate degree in nursing, to the extent that there's about a 6% spread in our data relative to unemployment by education. So approximately 53% of the nurses finding employment have 53% of the nurses who reported that they have an associate degree in nursing as their nursing degree are finding employment versus 55% for those with a baccalaureate degree and 59% of those with an entry-level master's. Next slide, please. So we asked new graduates in our survey why they were not getting jobs as nurses. And no surprise, the number one reason they're not getting jobs is because they have no experience in nursing. And this variable is unchanged from previous surveys we've done. So the largest stumbling block to finding a job in nursing is that you haven't had a job in nursing in the past. A little over half are being told that there are no positions available for new graduates, and this number is virtually unchanged from previous surveys as well. Some graduates are being told, some nurses are being told that not having a baccalaureate degree is a barrier to them finding employment, and about a third of nurse job seekers are being told that that is a barrier. And then this is becoming, this last item here on the list is a new one for the survey. And that is that 7% of graduates, newly licensed nurses now, are being told that they've been out of school too long. And that is something I think we need to track carefully, remembering that every 6 months, approximately, there is a new class of new graduates. And so as you have been out of school longer, there are more recent new graduates for employers to choose from. And it seems that having more recent, even student experience, is giving you an advantage over some of these new graduates who have not been able to find employment over sometimes the course of more than a year. Next slide, please. For those of new graduates who are employed, slightly over half of them have found their position within 3 months. And so that kind of seems to be the golden time period for employment. 65% of the nurses who are working are reporting that they're in a job of choice, so roughly 2/3 are working in a job that was the job that they wanted. And a little over 3/4 of new graduates are working full-time, which is great news, given the fact that this is a time period when nurses are really gaining confidence and building competence in their skill sets. So employment settings have changed just a little bit from a year ago. About 2/3 of new graduates are working in hospitals. A year ago, this number was 62%, so slightly up. New graduates are also working in long-term care in about the same percentages, as well as community-based facilities. And other is down just a little bit. So there are assisted living and some of those other job employment settings has shrunk just a little bit. Next slide, please. And what are these unemployed nurses doing since they can't find jobs? Well, a lot of them are working in non-registered nurse positions, and anecdotally in the survey they report that many of these are positions that they were in while they were in school to provide income while they were in school, and when they were not able to find employment in RN positions, they just continued with those previous employment roles. Many of them are returning to school. They're continuing their education. This is an opportune time to do that since they are not able to find employment as a nurse. They're volunteering, hoping that that volunteer experience will give them an edge to employment, and sometimes they're doing a combination of all of these things. So they're looking for ways to make themselves more marketable to employers. And Joanne, I think I'm going to turn it back to you to talk about employer and nurse perceptions with recent data on RN employment and education.
Thanks, Judy. These data that you've seen from the chief nursing officers, the HR vacancy and turnover survey, and the survey of new graduates line up pretty closely with other survey data that the Board of Registered Nursing collects from registered nurses and from nursing schools. The 2012 Board of Registered Nursing survey of RNs was presented to the board in February of this year. That survey indicates that the employment rate of California nurses across California has gone down to 85.1% in 2012, which is the lowest rate of employment that we've seen since 1997. 1997, as you'll note, was another period of time where there was a sense that there might be a surplus of nurses in California. So 14.9% of registered nurses holding active licenses indicated that they were not employed in a nursing position in 2012, and 15.5% of those employed indicated that they had more than one registered nursing job. The employment rate of registered nurses varies significantly by age. Among nurses who are maintaining their licenses, typically for nurses under the age of 40, around 95 to 100% of those RNs work. However, in 2012, less than 90% of registered nurses under the age of 40 were employed in a nursing position. This, along with the survey work that Judy has done at the California Institute of Nursing and Healthcare, really suggests that there are more young and newly graduated registered nurses who are unable to work now as compared to previous years. Conversely, among the older age groups, there has been an increase in the employment rate over the past few years. Especially in 2010, you can see that nurses over the age of 50 were much more likely to be working than they had been in 2006 and 2008. Those employment rates dropped back a little bit between 2010 and 2012, which may be indicative of a strengthening economy. There's a long literature and a long history of information that suggests that when the overall economy becomes worse, nurses, spouses, and partners are more likely to be unemployed or underemployed, and registered nurses will often increase their hours of work or return to the labor market in order to make up for the lost earnings of their spouse or partner. Registered nurses who were not currently employed in nursing were asked the reasons for not having a job. The first three columns indicate the data for 2008, 2010, and 2012. Now, of course, about 30% of registered, or more than 30% of registered nurses who indicate they're not working in registered nursing say that they're retired. And, of course, those nurses tend to be older. As you can see from the rightmost column, over half of nurses 55 and older who are not working in nursing indicate the reason they're not working is because of retirement. For younger nurses, child care responsibilities are a more common reason for nurses not having a registered nursing job. As a share of the overall nursing population, that has dropped as a reason for not being employed in nursing over the past several years. Other family responsibilities also have become a less important reason for not working than in the past, along with stress on the job. What has risen in importance for reasons not having a registered nursing position is difficulty finding nursing positions, inability to find any RN work, or difficulty of finding a desirable RN job. In 2012, nearly 21% of RNs who were not working indicated they couldn't find any registered nursing work, and 28.3% said it was difficult to find a desired job. Those shares were much higher among registered nurses under the age of 55, with 40.6% of nurses who were not working and under the age of 55 saying the reason they weren't working is it was difficult to find a desirable job, and nearly 36% couldn't find any work. Even among registered nurses with experience, aged 55 and older, 12% say they can't find any work, and over 21% find it difficult to find a desirable position. The average income from nursing positions has stabilized in recent years, which is another sign of a labor market that is weakening. During periods of shortages, wages tend to rise rapidly as employers are bidding against each other to recruit the scarce pool of nurses available to work. And during periods of surplus, the wages tend to stabilize or even drop. Between 2010 and 2012, the average income from all nursing positions reported by RNs dropped from $82,000 to just over $78,000, again indicating a weaker labor market. Registered nurses are asked about their plans for employment over the next 5 years. They've been asked this question since 1990 in the Board of Registered Nursing surveys. As you can see, there have been changes over time in their employment plans. In 2012, about half of registered nurses indicated they wanted to continue to work about as much as they were at that in 2012 over the next 5 years. But 21% indicated that they expect to reduce their hours, and 11.4% plan to increase their hours. 14.2% indicate that they plan to leave nursing or retire, which is closer to the rate that reported that same answer from 2004 to 2008. In 2010, there was a decline in the share of nurses that said they plan to retire in the next 5 years, which we thought at that time was a result of the recession and nurses looking at their stock portfolios and their retirement savings accounts and realizing that there was not as much money as they needed to retire. So this return to closer to historic rates might suggest that registered nurses are finding that their retirement savings are getting replenished and that their additional years of work may be helping them get into a financial position to retire. In the annual school survey conducted by the Board of Registered Nursing, deans and directors are asked to report what % of their graduates from the prior year do they think is currently employed. The bottom row indicates what share deans and directors think is employed in California. In 2008-2009, deans and directors thought that nearly 84% of their graduates were working in California as registered nurses. But in 2011-2012, less than 70% thought that their graduates from the previous year were employed in nursing in California. Some of those nurses who are not employed in nursing in California may have left the state, and some of them may be unemployed. Both scenarios seem quite likely. Of those who are employed, a lower share of them is thought by deans and directors to be employed in hospitals than in the past. So it seems like most of the employment decline has come out of the hospital setting. Now, what do these data all tell us about what the long-term supply and demand for registered nursing in California might be? The California Board of Registered Nursing has published forecasts of supply and demand since 1995 or since 2005, and the most recent forecasts were presented to the board in 2013 in the April board meeting. The forecasting model that is used by the board is what people typically call a stock and flow model. The stock refers to the green oval, which is the number of nurses with active licenses who live in California. This is the stock of nurses who are currently available to work and licensed to work in the state. This stock is affected by the inflow of nurses, who are typically people who graduate from RN education programs, as well as nurses who move to California from other states and from overseas. And the outflow of nurses is dominated by nurses who let their licenses lapse, typically because they either retired or they moved out of California. Of that stock of nurses, they make decisions about how much they're going to work and whether they're going to work at all, and that produces for us a full-time equivalent supply of registered nurses. So in this model, we estimate the inflows and the outflows of registered nurses as well as the total number of nurses. The current data on the numbers of RNs come from licensing records of the Board of Registered Nursing. And then we use the 2012 survey data to get employment patterns by age groups. We use the graduation data from the annual schools report to estimate changes in the inflow of nurses now and in the future, as well as data from the Board of Registered Nursing on endorsement requests for nurses into California from other states and to leave California from our state, transitions between active and inactive status, and transitions between having an active license versus a lapsed license. In the new forecast, we are relying more heavily on Board of Registered Nursing data for the state-to-state migration estimates. In the past, we've been able to use the National Sample Survey of Registered Nursing data, which in 2008 asked respondents where they were working in 2007. From those data, we were able to estimate the share of nurses who lived outside of California in 2007 who moved in by 2008, and conversely, the share that lived out in California in 2007 who lived elsewhere in 2008. And those data provided estimates of state-to-state migration. However, due to the recession, data from the California Department of Finance indicate that over the past several years, state-to-state migration has changed substantially for California, and we believe that these older estimates from the National Sample Survey may no longer apply to what will happen in the future. There was not a national sample survey conducted in 2012, and we are not sure when or if another one will be conducted. So we're going to be relying more on state data about endorsement requests into and out of California in order to estimate state-to-state migration of nurses. We also added high and low estimates for employment rates, with the highest rate of employment being the highest rate for each age group coming from either the 2008, 2010, or 2012 survey, and the lowest rate coming from the lowest for each age group from those surveys. So typically for the younger nurses, the highest employment rates were observed in 2008, and the lowest rates of employment for those nurses were observed in 2010 or 12. And the reverse is true for the older nurses. Graduations have changed in California over the past several years. Over the past decade, there's been more than a doubling of the number of graduates coming from California RN education programs. Nursing deans and directors in the state need to be lauded for the tremendous efforts they made to grow their programs so successfully over the past decade. In the annual school survey, they are asked to estimate what their enrollment will be next year and the year after that. And as you can see, they are projecting declines in new enrollments over the next 2 academic years. These portend future drops in the number of graduations from California nursing education programs. When we put all of these data into the supply forecast, we produce a range of high and low estimated forecasts based on employment rate data, as I described earlier. The gray line is the forecast from the 2007 or 2011 forecast report, which, as I said earlier, relied heavily on high estimates of interstate migration from the National Sample Survey of Registered Nursing. When we downgrade those estimates of interstate migration, in other words, we don't expect that California is going to recruit as many nurses from other states successfully as we have in the past. You can see that our best supply forecast is somewhat dampened as compared to the 2011 forecast. When we compare this forecast to projected growth in the California population from the California Department of Finance, you can see that on average our supply of nurses will probably stay stable or even decline slightly relative to our overall statewide population. We will continue to be below the 25th percentile of the United States. In other words, at least 37 or more states will be higher than us. Right now, it's about 47 states have more nurses per capita than we do, and we'll definitely be well below the national average. Comparing the supply data to demand is tricky because it's not entirely clear what demand benchmark we should focus on. We often like to compare our statewide supply of nurses to national benchmarks such as the number of employed RNs per 100,000 or full-time equivalent RNs per 100,000, as you saw in the previous slide. California was ranked 48th in 2008, and we've consistently been between 48th and 50th over the past decade or so. Other ways that we can benchmark demand is by using estimates that are published by the Bureau of Labor Statistics. They have published a forecast of the demand for RNs in the year 2020. They estimated that the demand would be 275,782 full-time equivalent positions in 2020. We also have computed the estimated demand for registered nurses in California based on California Office of Statewide Health Planning and Development data on hospital utilization and the number of patient days per age group in California. Because the population of California is aging, we expect that in the future there will be greater demand for hospital care due both to population growth overall as well as an older population. So this methodology enables us to adjust for estimates of future demand, accounting for age differences. Details of this method are described in the reports that are published by the Board of Registered Nursing on forecasting methods. The forecasts of registered nursing demand, as you can see, have some variation. The lowest dotted line that is kind of rust-colored and the solid line above that are the estimates of future demand based on using hours per patient day from California hospitals as a method to account for aging of our population. As you can see, those lines indicate more rapid growth in the demand for nurses in the future than do straight benchmarking measures such as going off of the national 25th percentile of RNs per capita or the national average RNs per capita. That little black dot there in the middle is the estimate from the U.S. Department of Labor, California Employment Development Department for 2020. You can see that these estimates all generally indicate that by 2030 the demand for registered nurses will be somewhere between about 290,000 jobs and 350,000 jobs. And depending on what we expect the future utilization of hospital services to be and healthcare in general, that we may be on the higher end of that range or the lower end of that range. When we compare those supply and demand estimates, this is just some of the selected supply and demand estimates. The rust-colored line is the supply estimate that we think is the best estimate that we've got right now. The lower dotted line is the national 25th percentile if we wanted to reach that level for 25th percentile of full-time equivalent RNs per population. And the darker dashed line above that is the national average of full-time equivalent registered nurses per population. The gray line is the line that is benchmarked off of the patient day-based forecast as described previously, and as I noted previously, that line indicates more rapid growth in demand than do the general population numbers. No matter how we look at these numbers, we are projected to face a shortfall of registered nurses in the mid and long term. So even though right now it may feel in some parts of California like there's a surplus of nurses, in the long term we do not expect that surplus to last. These forecasts are consistent with national forecasts that have been published by Peter Buerhaus, Doug Steger, and David Auerbach that also indicate that right now in some parts of the country there may be a perception of nurse surplus, but in the mid to long term that surplus is going to go away. So given that we know that we are likely to be in a shortage situation in the near future, what do we need to do to ensure that we have an adequate nurse supply? Well, we've got a few problems that we need to deal with. One is trying to figure out how we define shortage. Do we believe that current employment levels are adequate in order to deliver the quality of care that we want and to meet the needs of all Californians, particularly as the Affordable Care Act is implemented and the share of Californians with health insurance rises? Do we think that California should be at the national average of RNs per capita? Should we be at the 48th or the 50th position? What is the appropriate level of supply for our labor market? And do we want to base our estimates of demand on what we think population needs are or what we think we can afford and what employers can pay for? We'd like to think of it in the context of patient needs and patient demands. However, the reality is we all live within limited budgets, and the healthcare system budgets are going to be tightening even though the enrollments in health insurance are likely to rise. In this economy, we are seeing demand begin to ramp up again, probably because with the economic improvement, nurses are seeing more jobs available to them, and also their spouses and partners are obtaining jobs, so the older nurses who might have increased their hours temporarily to maintain their family finances are reducing their hours of work. So if RN education continues to contract, our supply is going to fall far short of demand in the future. In the short term, though, we have the problem of whether recent graduates who can't find work are going to leave California permanently, or they're going to find themselves unemployable because they're not able to maintain their skills or pursue additional education very easily. So what are some of the different policy things we need to look at? I think the most important thing we need to keep our state focused on is to not allow there to be declines in RN education program sizes. We worked very, very hard to increase our educational capacity for registered nursing over the past decade in order to address that severe shortage that we went through. And we have no interest in going into that kind of a shortage again. It is very difficult to ramp up the size of a nursing education program, and so we really should be focusing on maintaining the sizes of programs at the minimum. And if ideally, it would be great if we could grow those programs a bit more. But at the same time, we need to identify strategies such as new graduate residency programs to retain new graduate skills and to get them employed as quickly as possible. Now, we have a website that is available at the link above, and these slides will be posted on the internet so you can get the link later, where we are trying to maintain a dashboard of nursing demand and supply for the state. This brings together multiple data sources, and SYNC and the Hospital Association of Southern California, and we are working together to ensure that we are all cross-linking all of the data that we find so that no matter which website you go to, you're able to access all the latest data. You can also go to the Board of Registered Nursing website, and one of the tricks on that website is that the publications are actually buried under the Forms tab. It's not a very intuitive place to look for publications, but if you click on that Forms tab, you will then get a drop-down that indicates where you can click for publications. From that link, you'll be able to find the annual school surveys reports. In fact, the regional reports for the most recent academic year were just posted yesterday on that website. You'll also find the full reports for the registered nursing surveys that are done every 2 years, and a link to a web page that has summary data where you can compute for yourself regional and other cuts of the data. The full forecasting reports are posted there as well, and whenever we have the opportunity to produce regional reports, we will put them there as well. The Board of Registered Nursing conducts other various studies also. For example, in 2010, they conducted a survey of advanced practice registered nurses. So if you want to learn more about our nurse practitioner and nurse midwife workforce, as well as our clinical nurse specialist workforce, you can find those reports on the BRN website. So what's happening next? Well, UCSF and the Hospital Association of Southern California are continuing our collaboration. We'll be beginning planning for the fall surveys over this summer, and HASC is continuing to do its quarterly surveys of human resources directors. So we greatly appreciate everybody's participation in those HASC surveys. UCSF is going to continue to do annual Chief Nursing Officer surveys for the foreseeable future, and we will be working with HASC to bring all of these data together to ensure that our picture of the current supply and demand situation is as rich as possible. The 2012 Board of Registered Nursing Survey of RNs reports will be published soon, and the 2012-2013 BRN Annual School Survey is going to be sent to deans and directors in October, as usual, and the draft report will be submitted at the end of the year with a publication usually occurring somewhere around February. So you can keep your eyes open for all those new data, and we'll be continuing to update our forecasts as these new data become available. So we're all happy now to entertain any questions you might have. Please type your questions in, and we will be responding to them. It takes a couple minutes for us to get them together and start responding. But and Judy, Terry, and I can all answer questions. And if you want a specific person to respond, please go ahead and preface your question with their name. Otherwise, we'll just field the questions as our relative expertise or knowledge enables us to do so. We're still waiting for questions. Aha. Our first question is, what data do we have regarding nurse educators in pre-licensure programs? We have two sources of information about nurse educators. The first is that the Board of Registered Nursing Annual School Survey and the reports that are published from those include information about the number of faculty employed in RN education programs, both pre-licensure and post-licensure programs. Those are reported separately. And it includes their age distribution and other information about the demographics of faculty. So you can go to the Board of Registered Nursing website and download the annual schools reports data, and you'll be able to see all kinds of information about the faculty statewide and for different regions of California. You can also find some information about nurse educators in the Board of Registered Nursing's biennial surveys of registered nurses. Registered nurses are asked about their employment setting and job title, and so there is some information in that report about nurses who are engaged in educational roles.
Joanne, this is Terry. I have a question that I have been curious about. For those nurses who are unable to find employment and return to school, do they typically continue with their nursing education, or do they change studies, areas of study?
That's an excellent question. You know, that is something that we probably could look at in the Board of Registered Nursing surveys. There's always a question about whether the licensed nurse who responds to the survey is currently enrolled, and I don't recall that there's been any change in the share that say that they're enrolled in a nursing program versus a non-nursing program. But we can double check those data and make sure to highlight that in the next Board of Registered Nursing survey report.
Okay, thank you.
Terry,
yes.
Just from the survey that we do of the new graduates themselves, newly licensed nurses themselves, about 15% of those who report that they are not working in a nursing position indicate that what they are doing is continuing their education.
Okay.
So about 23% say they're working in a non-nursing job. 18% say they're working in a healthcare job but not as an RN, and then 15% are continuing their education, 13% are volunteering, et cetera, and some are doing a combination of those things.
I see.
Yeah, returning to school is a great thing to do, and I think you see this across multiple professions. I know in the past when there have been reductions in jobs available for engineers, you see a lot of engineers going back to get master's degrees. And I think registered nurses, especially those with associate degrees, can view this as an opportunity to invest in their bachelor's degree. So we have another question of whether the number of clinical nurse specialists is increasing or decreasing. The data that we've seen generally suggests that the number of CNSs has been decreasing over time. More nurses are pursuing nurse practitioner education, and somewhat fewer have been pursuing clinical nurse specialist certification. So there have been declines in the numbers of CNSs, both in California and nationally over the past couple of decades. We have another question of whether we have computed the average age of retirement for RNs and whether that's changed over the past decade. That is an excellent question, because I think the definition of retirement is challenging or is not entirely clear. In the 2010 Board of Registered Nursing survey, I think it was asked whether the nurse had retired in the past year. And then, of course, there were questions about their current employment and so on. And in that survey, we found that there were a lot of nurses who reported all about their current employment, and then in that question about changes in the past year indicated that they had retired in the past year. Now, we spent a while digging through these surveys and looking at them by hand to try to figure out whether those were nurses who then were telling us all about the job that they had retired from. So in the current employment section, it was actually past employment that they were telling us about. And we came to the conclusion that for most of them, what they had done was retired from what they had viewed as their career job, but were still working in some capacity, perhaps in a different role or in a different employment setting. And so while they viewed themselves as having retired in the past year, they had not actually stopped working. That makes it really difficult to try to figure out when people are retiring. And one of the broad questions that I think we all are facing is what will be the retirement patterns of the baby boomer generation. The baby boomer generation is a population, particularly of women, that's been more career-focused and career-dedicated than previous generations, and they also are facing significantly longer life expectancy than previous generations. We think that there may be many baby boomers who look at the prospect of retiring at 65 and either feel like they don't want to be out of work for that long because they love their work, and or they may not feel like they can afford to live another 20 years without any form of employment. So I expect that we may see more creative ways for nurses to continue to maintain their contributions to the nursing profession, but not necessarily at the same degree of intensity or in the exact same roles that they've had in the past. But we could be wrong about that. They all might be chomping at the bit and excited to retire and enjoy 20 years of retirement or more than 20 years of retirement, and as soon as the economy is better, they may all retire in droves. We just don't know yet what's going to happen with that population. Another question raised is whether there's a forecast for nursing administration positions with regards to supply. Well, right now what we're seeing is that the demand for other nursing positions, which is those non-direct care positions, is greater than for staff nurses and has been recovering more rapidly than for direct care staff nurses. Whether statewide there will be an increase in the demand for nursing administration positions that's any different or greater or less than general nursing positions is really not known. The forecasting models don't enable us to break that down. Terry, do you have any thoughts about that, or Judy?
Judy, I didn't know. I would agree with your comments there, Joanne. We here at the Hospital Association produce a compensation survey, so we're constantly gauging some of the, the trends of not only workforce but salaries and emerging jobs. And so I'm in full agreement with the comments made by Joanne.
Yes, I agree. And I think when you look at positions being recruited for, some of the most difficult positions reportedly to fill are those that have administrative responsibilities in them.
Great. So we'll give it another moment or two. We don't have any questions pending right now, so we'll give it another moment or two to see if any more questions come in. And then, and we just got one. Great. Let's see. Are the survey's instruments available to better understand what types of data are collected? Certainly for the Board of Registered Nursing Surveys, the appendices of those reports include the full survey instruments. And they're also, for the Board of Registered Nursing Surveys, are public use data files available upon request for researchers who want to analyze the individual level data. Those data are de-identified. All the analytic files do not have anybody's names or address or anything that would be identifying in them. The public files only indicate the region of California in which the respondent lives, so that there is, the absolute privacy available for the people who respond to these surveys. The annual school survey is available both in the reports as well as a downloadable Excel file that you can use to analyze the data and make your own regional or type of school program analyses. And if the full survey questionnaire is not posted online, please email us and we can make sure you get that. Judy, what do you have available for your report?
Yes, our survey instrument itself is not available. It's a Survey Monkey instrument, and it itself is not available, but the data is available broken down by region in the state for those who request it. And all they need to do is contact the California Institute for Nursing and Healthcare on our website, and we're happy to provide data that is more regional in nature.
And Terry, what about the survey instrument for the vacancy and turnover data? Is there a place where the spreadsheets that are used for that are available for people to look at?
Yes, it is available to members of the California Hospital Association. So if you are in a member hospital, you're able to access the survey instrument through the Healthcare HR Source portal. So this is a members-only survey available to those who are members of CHA.
And the Chief Nursing Officer survey, just email me and I'll send it to you. I see, I'm looking now at the names of the questioners, and Tim, shoot me an email. I'll send it to you. Let's see, the next question we have right now is, do we have any sense about what kinds of positions doctorate of nursing practice graduates are getting and what kinds of institutions are employing them? From the California BRN survey in 2012, yet again, we had too few nurses report that they held a doctorate of either a DNP or a PhD in nursing or another field. There were too few respondents who reported they had doctorate level education to really do those kinds of tabulations. Now, because these DNP programs are growing so rapidly, it's entirely likely that by the 2014 survey we'll have enough respondents to be able to tabulate those data. So I do not have a very good sense about where they're being hired or what kinds of hiring opportunities that they may have that are distinct from a traditional master's level nurse practitioner graduate. Judy, are you seeing any trends or hearing anything about DNP employment?
I'm not. I am just noticing that it's not unusual now to see a faculty person with a DNP credential, which is kind of interesting, as I know the DNP was created as a practice doctorate, not necessarily an academic doctorate. I'm also noticing it probably less true in California, but more true as you go east in the country. The chief nurse in an organization, it is not unusual to see a DNP credential for that person. But I have not seen any data around it.
All right. We'll wait another moment and see if any other questions come in before we conclude. It looks like we might not have any other questions coming in, so I think we can conclude now. This webinar has been recorded, and we will be posting it online. We will be sending an email to everybody who was invited to the webinar, as well as everybody who registered for the webinar, to let you know when the recording and the slides are posted online. Also, if you go to the Board of Registered Nursing website, you can get notification for when all of their reports are published. Judy, I believe that SYNC has an email list for that people can sign up for. Is that correct?
Absolutely, and we would love that. All you need to do is go to www.cinhc.org, and it's available there.
And then for the Hospital Association of Southern California, if you're a member of the association or are responding to these surveys, then you can access all of their data and would get all of those notifications right away. And of course, if you'd like to be on our mailing list for when we release the statewide Chief Nursing Officer HR Survey combined reports every year, please do send me an email or Leela Chu an email, and we'll make sure you're on those communication lists. Thank you very much, everybody, for participating in this webinar, and we look forward to providing you with more information and data as we have it. Thank you.
Thank you.